what would a smaller center or private practice need to really administer these drugs safely?
Both the drugs have a 24-hour hospital monitoring requirement. Glofi has about on cycle 1 day 8, EPCO is on cycle 1 day 15. If you have an infusion center that's attached to a hospital, that's great. If you work in a private practice that's only an infusion center, but the hospital is across the street or they have to drive, driving is not safe. So that's a big challenge. You need to have an infusion center next to the hospital. Second is after you give this infusion, if the patient has to come back or if they get an cytokine release syndrome, you need to have tocilizumab available. This is not a medicine that every hospital or pharmacy has. So it's going to be pretty challenging to have a lot of cancer centers to be able to give this because of this very reason. It's not just the oncologist, it's the hospital emergency room also need to be educated about cytokine release syndrome because they need to have TOC available. The ER doesn't carry it, they don't know what CRS is, then your patient's going to be at a disservice because they will treat it like sepsis. And TOC works amazingly well. The time to resolution is about a couple of hours with the fevers and other symptoms. So there's a lot more education, not just the oncology practice, but everybody else involved, including emergency room physicians, ICU doctors. And this will eventually come, but we're not there yet.